approaching scene for safety. I can see the scene is safe to approach. I'm going to provide privacy and show enough dignity. I can see mother is having skin to skin with the baby, and baby is also safe. I'm going to perform a hand hygiene following WHO guidance with some gel in my palm, palm to palm, palm to back, fingers interlock, fingertips, finger interlace, thumb, erase, and I'll leave it to air dry for complete 60 seconds. Hello, my name is Anita. I'm one of the midwives here. I'm here to support you so that we can have examination of your newborn. Is that okay? First of all, can I know your full name and date of birth, please? Okay, Helen Johnson, is it okay if I double check your details against your wristband? So I'll check the wristband and I have Helen Johnson, 15 June 1989, hospital number 004321. Helen Johnson, would you like me to confirm your baby's details against on the wristband as well? So I can confirm the baby has some tag around the leg. So I'm checking the details and I have male infant of Helen Johnson, date of birth 2nd October 2024 at 0900. I also have male infant of Helen Johnson, 2nd October at 0900. I can confirm I have the patient's details over here. Helen, have you got any allergies, and what happens when you come in contact with those allergies? Oh, okay. So okay, so we make sure that you are not given any medication containing any of the allergies you have mentioned. Is that okay? I've got a bit of a history here. Would you want us to review your history and to identify if there are any risk factors that may pertain to the examination of the newborn? Okay. So over here it states that you had your ultrasound scan at 16 weeks and there were no abnormalities detected. At 20 weeks, the ultrasound scan was repeated for anomalies. However, it picked up a nuchal fold of 6 millimeters and you declined further follow-up. You also had a spontaneous vaginal delivery of a live male. You went through delivery for 7 hours, no complications, and an immediate examination was done on the baby. There were no birthmarks whatsoever and everything was normal. Can you confirm this history is correct? Is there any additional information that was picked up that you want me to write it, which was not mentioned? Okay, so whilst reviewing your history, identify that baby has a risk factor upon which, based on that, I'll be doing the examination. That is the nuchal fold measuring 6 millimeters. And since you declined for that follow-up, we don't know what at all could be happening. Could it be that it dissolved or it picked up something else? We don't know. But we are going to do this examination, which we do for every baby, not because of the risk factor, but we do for every baby before they are being discharged. Is that okay? Is it okay for me to get ready and come back? Okay. So I'm going to be repeating my hand hygiene once again. Leave it to air dry for complete 30 seconds. Put on my apron. And a pair of examination gloves. So first of all, I'm going to be checking baby's temperature. So what I have got with me today is the thermometer gun, but you can get a temper dot or an actual thermometer. So I'm going to use my tip, and I had 37.1, so which is normal. Hello, baby. So now I'm just going to make sure that baby is warm throughout. But I'm going to be exposing baby so that I can have a full view. As I am exposing baby, I'm going to leave the nappy on, and when I'm ready to do examination of babies down below, I will take the nappy off because I wouldn't want baby to make a wee in the clothing. Other than that, it will make the body cold. I also take baby's hat off as well. Then I wrap baby. So whilst I was taking baby's clothing off, I was checking for baby's symmetry, color, activity and movement and tone as well. And I can see that baby has good tone, baby is symmetrical, baby is pink in color. I can see no birthmark around, but as I move along, I'll be checking into details to see if there's any birthmark as well. And I can see that baby was well flexed when I was changing the nappy. So first of all, I'm moving to the head of the baby. So first of all, I'm moving to the head of the baby. I'm checking for the alignment of the sutures and fontanelles, and I can confirm they are in alignment. I'm also going to use the tape measure to check for the head circumference of the baby. And I have 33 centimeters, so I'm happy with the head circumference. And also I can see that baby has beautiful hair. I'm also checking baby's face. I'm checking for, and I can confirm that baby has 2 ears, 2 lips, 2 nostrils, and 2 eyes. Next, I'm checking baby's eyes. So I'm checking if there's any extensive port wine stain on the eyes, and I can confirm there's no extensive port wine stain. I'm also checking for the symmetry of baby's eyes, and both are symmetrical. I'm checking for the sclera, and I can see there is no black stain on baby's eyes, nor any yellowish discoloration. I'm also checking for the clarity of the cornea, and I can see that it is clear. So I'm going to use my ophthalmoscope to check for what we call the red reflex, Helen. I'm going to check the red reflex of the baby, so I'm going to turn on the light. Yes, so I'm going to look through and focus it on the left eye. So I'm checking for red reflex. I can confirm baby has normal red reflex on the left eye. I'm checking the right, and I can confirm baby has normal red reflex on the right eye. So I'm turning this off. I'm also checking baby's nose. I'm checking for the symmetry of the nose. I'm checking for the patency and any signs of nasal flaring, and I can see there is none as such. I'm also checking patient's lips for any cleft lip. I'm going to use my tongue depressor to pat baby's mouth to check for any cleft palate and any tongue tie, and I can confirm none. Helen, can I ask, has baby started feeding? Oh, okay, then I can confirm that suckling reflex is present. I'm also going to stroke baby's cheek to check if baby is going to move towards where I have stroked. As I'm not confirm with me, since I'm working on a mannequin, did baby move towards where I stroke? Oh, okay, then I can confirm that rooting reflex is present. I'm also going to pat baby's neck to check for any signs of swelling. There is no signs of swelling. I'm checking for any clavicular fracture. There is no clavicular fracture. I'm going to expose baby's limbs whilst I keep the rest of the body warm. Okay, so I'm bringing baby's limbs together. I'm checking for equality and symmetry. I can confirm they are both equal. I'm counting the digits 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. I can confirm that baby has equal digits. Now I'm going to check from the chest. So with the chest, I'm going to do it in 3 sections. I'm going to do observation. First of all, I'm checking the chest for any central cyanosis and peripheral cyanosis. I can confirm there is no cyanosis present. I also can confirm the baby has a good tone. I'm also observing the respiratory rate by counting the rise and fall of the chest for complete 1 minute. And examiner, what is the results? Oh, okay, 58. So I can confirm the respiratory rate is normal. I'm also going to auscultate for baby's heart rate for complete 1 minute. My 1 minute is up. Examiner, what is my fetal heart rate? 140. Oh, okay, 140 is normal. Helen, I'm also going to do what we call palpation. First of all, I'm going to press the midpoint of the chest for complete 5 minutes at 5, 4, 3, 2, 1. And I'm expecting a reperfusion not more than 3 seconds. I'm also going to palpate your brachial artery. and also palpate your brachial, your femoral pulse. Now I'm checking the two together to check for strength, rhythm, and volume, and I can confirm they are both strong, rhythmic, and voluminous. Okay, then the last one I'm going to check is the palpate for the liver to rule out any hepatomegaly, which is the right side just underneath the rib. So I'm palpating the area. Examine, is there any signs of swelling of the liver or the spleen? Okay, now I'm done with the palpation aspect. The next one I'm going to do is auscultation. I'm going to be listening to 5 areas of the heart. Don't mind me, Helen, if I'm taking too long. It's because I want to listen to each of them carefully to listen for any extra heart sounds and murmurs. So the first one is the pulmonary area, which is the upper left sternal edge. Then I'm having a feel at the aortic area, which is the upper right sternal edge. Then I come to the tricuspid area, which is the lower left sternal edge. Then I come to the mitral area, which is the apex of the heart. Then the last one is the mid scapulae, which is at the coarctation area, which is at the mid scapulae. Okay, I'm done listening to the 5 areas. Helen, I've listened and they are all normal, so I have no concerns. Let's keep baby warm. The next thing is I'm just going to expose the tummy area. First of all, I'm checking the navel. I can see that the cord is dry, clean. There's no sign of bleeding. As I palpate too, the baby is not making any crying sounds, so baby does not have any concerns with abdominal pain. Helen, I'm going to skip the examination of your baby's hip and testis. When I'm done with the rest of the examination, I'll come back and focus on the hip and testis. Is that okay? So moving on to the lower limbs, I'm going to count the digits. 1 2 3 4 5. 1 2 3 4 5. I can confirm I have equal digits. Now I'm going to move baby to the side. Yes, just to rest on my arm. Then I'm going to check the symmetry of the vertebral column, and I can confirm it is symmetrical. I'm also checking for any spinal neural tube defects, and I can confirm there are no neural tube defects. Then I'm going to observe for the sacral dimple. Yes, I can see that there is a sacral dimple. Helen, I'm going to do what we call the primitive walk. So I'm just going to support baby to see if baby is going to take a step. Okay, so pre-examiner, confirm with me primitive walking is present. Okay, Helen, I'm going to do what we call the moral reflex. It's going to look as if I'm going to throw your baby, but I'm not going to throw baby. I just want to see baby is going to startle and widen up. Is that okay? Okay, examiner, confirm with me is moral reflex present. Helen, let's keep baby warm whilst I talk to you about the hip and testis screening examination I am about to do. Yes, so the first one is I want to talk to you about the screening examination of the hip. So the reason why we are doing this examination is to identify any dislocated or dislocatable hip. This examination, we do it for every baby before they are discharged within the first 72 hours and repeated 6 to 8 weeks by the GP. There are some risk factors that may prone a baby to having either a dislocated or dislocatable hip, or even a pathological hip dysplasia, and that is if there is a family history of any hip problem which was identified in their childhood area, or if the baby has been in a breech position for 36 weeks up to 36 weeks, irrespective of the mode of delivery, whether she had a C-section or even an external cephalic version to go for a vaginal delivery, she's still at risk. And also, if baby was delivered from 28 weeks to term when baby was in breech position, then baby is still having that risk factor, or baby is at risk. So if I do the examination and I have no concerns, routinely this examination is repeated 6 to 8 weeks by the GP. However, if I am concerned at any point, then we will have to refer to the senior pediatrician for review and an ultrasound scan to also be done within a targeted time scale. But most of the time, babies who are born less than 34 weeks, their ultrasound scan is done between 38 and 40 weeks corrected age. Is that okay? So are you okay for me to have the examination done? Okay, I'll be doing the examination in 2 forms. First, I'll be doing the observation. Under the observation, I'm going to check for the Galeazzi test. So with the Galeazzi test, I'll be checking for the equality of the knee when I flex both knees. So I'm going to ensure that both legs are on the bum, sitting on the bum. Then the bum too is also on the bed. So I flex it, yes, and I bring it together. And I'm going to check if it is not equal, then Alice sign is present. And I can confirm there is no Alice sign present. Yes, the next one is I'm going to check the symmetry of the leg length. I'm checking for the equality. Yes, I can confirm there is equality. Then the last one, I'm checking for restricted abduction of the hip inflection. As baby's legs are like this, both of them should be able to abduct equally. Yes, and both are adapting equally. It's not like one is longer than the other, or one is restricted and the other is smooth. So I'm done with the observation aspect. The next one I'm going to do is the manipulation aspect, but this I'll be taking your baby snappy off. Is that okay? So let's take baby snappy off. So we quickly do this so that baby does not make a wee. Yes, so the next one I'm going to do is the Ballo's test. So with the Ballo's test, I'm checking for dislocatable hip. And with the dislocatable hip, the femur head will be displayed out of the acetabulum. And with this one, I'm going to support baby's both legs, but I'm going to do one leg at a time, starting with the left hip. So I'm going to apply downward pressure. Examiner, confirm with me, is there any dislocatable hip present? Okay, doing the same for the right leg, I'm applying downward pressure. Examiner, confirm with me, is there any dislocatable hip present? Okay, this is normal. I'm going to do the second test, which is called Otolani. Now with the Otolani, I'm using to check for dislocated hip, and with the dislocated hip it will be making a clank sound. So with this one, both of them are in position. However, I'm going to ensure 3 fingers under the calf with my thumb at the inner thigh and my index finger at the greater trochanter. I flex it at an angle of 90 degrees and I adapt. Examiner, is there any clank sound heard? Okay, I'm going to do the same for this leg. Thumb at the inner thigh, index finger at the greater trochanter, flex at an angle of 90 degrees and adapt. Examiner, is there any dislocatable hip head? Okay, Helen, let's wrap baby clean, warm. So Helen, I'm done with the examination. Everything is normal. As I said, now that it is normal, your routine check will have to be done in 6 to 8 weeks by the GP. Is that okay? Now, there are other parental concerns I will want you to take note of. Should you identify any of them, please seek advice from your GP, either the midwife or the health visitor. And that is if baby's leg cannot move as far as the other when you are trying to change the nappy, and sometimes when they are starting to walk, you realize the baby is showing a waddling gait, or if baby one leg is crawling as the other leg drags along, then we are concerned. Is that okay? So the next one I'm going to do is the examination of the testis. So with the examination of the testis, we will be doing this in to identify bilateral or unilateral undescended testis and even hypospadia now. So this is done to every first 72 hours, just like the hip, and repeated 6 to 8 weeks by the GP. There are some risk factors that may prone a baby to getting it, and that is if there is a family history of undescended testis, either the baby's father or the sibling. Then we also have conditions and syndromes such as the Prader-Willi syndrome, yes, and the prune belly syndrome. Then we also may have prematurity also. So if we do the examination, as I mentioned, there are no concerns. Just like the hip, we have to repeat it in 6 to 8 weeks by the GP. However, if I am concerned at any point, then we will repeat it in if I am concerned at any point. The referral process is now in 2 forms. We may either refer under urgent review or refer under non-urgent review. So with the urgent review, there are certain conditions that if I identify, we will consider an urgent review, and the urgent review is within 24 hours to the associate specialist or the pediatrician consultant. Is that okay? So these conditions is bilateral impalpable testis, unilateral impalpable testis without hypospadia, unilateral palpable testis with hypospadia, and development of disorders of sexual development. So these are the 4 conditions that if I identify any of them, then we will require an urgent review. However, there is just one observation that if I picked up on baby, then we will require a non-urgent review, and that is either one or both testes are formed but not located in the scrotum without hypospadia. This does not require an urgent review. We will wait 4 and 5 months for a review by the GP, and on that time, if there is still persistent undescended testis, then we'll have to refer to the surgeon no later than 6 months of age. Is that okay? So I'm going to do your baby's testis examination. Is it okay to touch your baby's private part? Okay, so you're just going to expose babies down below. First of all, I'm checking for doing the observation, and I'm checking for the color, the symmetry, and the size of the scrotum. Examiner, confirm with me if any of these are normal. Okay, now I'm going to also warm my hands because I wouldn't want to stimulate or tickle baby. So the next one is I'm going to palpate possible areas where the testis could be located. So the first of all, I'm going to palpate the left groin. Examiner, is there any testis located? Okay, I'm palpating the right groin. Examiner, is there any testis located? So I'm going to flex baby's leg a little and palpate the perineum, which is the shortest distance between the scrotum and the anus. Examiner, is there any testis located? Okay, now I'm going to have a feel of the left scrotum. Examiner, is there any testis located? Having a feel of the right scrotum. Examiner, is there any testis located? Okay, Helen, so I've done your baby's examination. Everything is fine. Let me immediately pop the diaper on before baby makes a wee. Is that okay? So we are not concerned. So what we'll be doing is that the examination is going to be repeated 6 to 8 weeks by the GP, so which requires that you need to make sure that you've registered baby with the GP as well. Is that okay? Let me quickly document my procedure and I'll be back to give you a few health tips. Is that okay? Thank you. So I'm going to take off my apron and gloves, dispose it into the clinical waste bin. Repeat my hand hygiene following WHO guidelines. And document my findings. Yes, Helen, I am done with the documentation. I am back. Let's pop baby's hat back on. Yes, and keep baby warm and cozy. Would you like to cuddle with baby a little bit? Oh, okay, then we will just leave baby here. If you feel like you need to skin or just feed baby, yes, you can take baby out of the cot. Now there are few health education I want to start, and that is sleep safety. So can I ask, has baby got her own cot in the house? Okay, so we are trying to reduce the high risks and the incidence of sudden infant death syndrome. So we are encouraging that every mother should ensure that baby sleeps in the cot. When baby is sleeping in the cot, let baby lie on the back this way. Don't let baby lie on the belly or on the side. Do not put any nappies or wipes or anything in the cot, toys in the cot. Or ensure that baby is lying on a flat surface with no heavy duvets, as these can all cause choking. Is that okay? The second one I want to talk about is also car safety. Can I ask, has baby got a car seat? Okay, so with the car seat, ensure that baby is always in the car seat anytime you are moving out. And if you are taking a long travel, after every 30 minutes, take baby out of the car seat and cuddle baby a bit. Is that okay? Then the next one I also want to talk about is if you are also the one driving, ensure that your mirror is adjusted so that you can see baby from behind, and you can also monitor what is going on with baby. Is that okay? The next one I want to talk about is responsive feeding. So irrespective of the type of feed you are going for, whether you are breastfeeding or bottle feeding, we are encouraging that always watch out for baby's feeding cues. How do your baby react if they want to feed? Do they jeer their head more towards the nipple? So watch out for how your baby reacts when they want to feed. Is that okay? Also, we are encouraging that you should always feed baby frequently and also on demand. Then I want to talk to you about safety checks. So ensure that nobody is smoking around baby. Does anyone smoke in your house? Okay, well done. So please ensure, even if it's in the public, ensure that you are keeping a distance, because we do not want baby inhaling in the poisonous one, which is the carbon monoxide. Is that okay? Also ensure that the room temperature is always stable, the thermostat is working, the boilers are not faulty, as these two can also emit dangerous chemicals. Also ensure that all chemicals such as detergents, chemicals for laundries are all kept in a safe place and also in their respective bottles. And also ensure that baby's temperature and everything is fine. Is that okay? So these are a few health education I would like to talk about. If you have any concerns, you have our numbers. Always check your postpartum book, where our contacts are all there. Or you can also reach any GP. You can reach your GP, or if you are so concerned, do not hesitate to come to A&E. Is that okay? Now I also want to talk about some follow-up appointments. So in day 3, we are going to recheck baby's weight to check for the percentage weight loss. Another thing we are also going to do is in day 5, we are going to be taking a newborn blood spot sample from baby to check for conditions such as thalassemia, sickle cell, and cystic fibrosis. Other conditions as well, which we will explain everything to you before we continue. Is that okay? Another thing we will also do is your postnatal check will continue on day 10 to 12, and if everything is fine, you will be discharged to the health visitor who will continue to come to your house to ensure that everything is fine. Is that okay? We're also encouraging you for you to register baby's birth with the local council as well as the GP in order for baby to have a 6 to 8 weeks review done. Is that okay? Do you have any question for me? Okay, so look, I can see that baby is settled, so I'm just going to keep baby like that. And if you have any concerns, please do let me know, and thank you. I'm also going to leave you with a call bell. If you have any question at any point you may not have remembered now, do not hesitate to buzz and I'll be with you as soon as possible. Is that okay? Thank you very much.